Hello, you guys. My name is Miguel Gomez, fellow Xray tech student here, bringing you some more information. This time it will be the clinical aspect as the Xray tech, what kind of notes and documentations we take. Because compared to something else like nursing, which my lady's a nurse, they do like the most amount of notes like to document stuff like the patient's orders, the doctor's orders, a bunch of things. They have way more than we do. I first got frightened when she was telling me how much stuff she had to do, and I was like, will I, as X-ray tech, have to do that? Thank God we don't. We have it way more easier than they do. From what I've seen, what we document is kind of almost like the bare minimum, but it is still important. Like some of the big things we'll document is, for instance, we go for a floor exam. Let's say enema, right? So we'll document down when it was, what time, like on the post-processing thing, we'll like get on the computer, put our notes, be like, okay, when was it done? By who was it done? Was it either done by the radiologist or was it done by our PA? And then you put how much radiation was used, and then you put what type of like, was it gastrographin, was it barium, and you put the dose amount of that, the length he was, the level, the dose amount of radiation, the time of the whole procedure, and then you put like if there was any complications, or was there any like obstructions or something that you couldn't be able to perform the exam, and then you also document and you'll put like I got some scouts, and I got some post images, and then also another documentation is, and just if we go into the regular x-ray, so let's say you have a patient come in, he's pretty old, he can't do too much. So the doctor says, okay, I need let's say it's a hand. I need a 3-view hand. Okay, the patient comes in, he's in pain. Let's say he's in pain. He's broken something, okay? So the patient comes down, and you're like, okay, usually for hand x-rays, three views. It'd just be like the AP, oblique, and then the lateral. So let's say he can do the first one, he can do the oblique, but the lateral, he can't really do that because he's in so much pain. So usually you'll still take the x-ray unless like you see that it's really broken, and then there's no point of you actually putting him in pain because it can actually make it worse. But in your notes, you'll go back in, usually after post-processing, you'll put in patient was unable to perform said view. That covers us and saves us from being yelled at, well, not yelled at, but getting in trouble from the radiologist or the doctor. And then also we put like, you get the basic like information from the patient when he's coming in. You'll like ask, okay, what's been going on, how long has it been going on, what's the pain, what's the symptoms, and you put some of those. Usually the nurses will do it, and you'll have that basic information in, but sometimes they won't, and you also have to put it in our notes. Like let's say, okay, patient hand was broken from car accident, happened so and so date, this is what hurting, this medication he's taking. And also the medication, that's another big thing we have to write, especially more for floor exams, because there's certain things like blood thinners that the patient, you have to write down like what medications are on sometimes also. And then sometimes in ours, when we're transporting, we have to kind of document, well, at least I know in my hospital, because they've had some issues in the past. They made us no matter where the patient goes, if as soon as you get it, you'll document, okay, patient was received by so-and-so, and you'll sign. And then when he leaves your department, you'll document in a piece of paper, usually in the patient's little like binder folder that goes with them. You'll document, okay, patient left at so-and-so time. And then it'll be like who you gave it to. And then this isn't really documentation like written down, but our markers are used also in the documentation. Like that keeps us safe as x-ray techs. Like, did you mark it? And it was like by your name, because if you do post-processing, and let's say God forbid they take you to court because of some issue that happened, that right there would be like you cropped it off or something, but it's still there, you can be like, oh yeah, I did mark it, it's right there, there's my initials. That's kind of proof to keep us safe. And also another thing, when, especially for more younger patients, well, regardless of the patient, you're always supposed to shield. You can put in the notes patient was shielded, because sometimes the shield won't be there because like since it's on your waist or you can't see it, you have to document there that patient was shielded, because once again, God forbid something happens and then they want to blame you. Oh, you didn't document that that the patient was shielded. And then especially if it was just you by yourself and it's like your word against like the patient and you didn't actually document it, well, you can kind of get into a gray area. But overall, that's usually the stuff we document down. And then for some stuff, and then we also document like some of the equipment we use, more for like the fluoro aspects. Like we use a 10 cc syringe, or we use so much barium, or we use like the needles and stuff like that. That's another thing we'll also document down. And that's about it. And I hope this information helps, and have a good day.